I am joined now by Dr. Bruce Schwartz. He is the incoming president-elect. Congratulations.
Thank you very much.
How are you feeling about it?
It's wonderful. I think it's a terrific opportunity to really bring about some positive and substantial progress in our field.
Can you talk a bit about what specific things you want to accomplish?
Well, the biggest problem facing psychiatry today is that the people in our country have a very difficult time accessing mental health services. There's a severe shortage of providers who they can see. And for most people in many areas of the country, even if they have insurance, it's very hard for them to get care. And when you think that psychiatric disorders and substance abuse are really major drivers of disability and lost productivity, the fact that so many people have a problem getting care is a serious issue. We're also in the midst of an opiate epidemic in this country. And last year, over 60,000 people died of opiate overdoses. So substance abuse really has moved to the top of the list of problems, but that doesn't mean that the other problems facing many people are still very much in need of care.
Absolutely. You've held a number of different positions in your career. How has APA helped you? And what would you tell young people in this industry why APA is so important?
All right, so my career has always been based in the public sector, working with more seriously mentally ill patients. First at Jacobi Hospital, which is a New York City hospital, and then at Montefiore Medical Center. And I would tell any early career psychiatrist, identify the things that you're interested in, and then get involved in a council. Because aside from contributing your knowledge and expertise to the APA, you gain much more in return in terms of an expertise, which is really translatable in terms of your career.
One thing you talked a lot about during your campaign is the importance for funding psychiatric research and training programs. So can you talk a bit about why that was important?
When you look at mental illness, in comparison to other illnesses in our society that get funding from the federal government, the funding for mental health research is a fraction of what it is. Despite the suicides and overdoses and how much productivity is lost and disability is caused by these disorders, any fair approximation would automatically call for a 2, 3, 4, 5-fold increase in funding. The other area that we really need money for is training. That the number of psychiatric training programs has remained relatively constant in terms of the flow, the increase in numbers that are needed to address these problems.
Well, keep fighting, keep up the good work. Thank you so much for sitting down with me and talking about this, and best of luck at the APA.
Thank you.
Thank you.